in terms of research. All right. So one of the things that I'm really excited about this course, we've decided to revamp or just change the way that we deliver this course. We've traditionally, over the last couple of years, have done traditional lectures. So we just stand up here for the entire 12 weeks of the semester and we've just lectured. But we've decided not to do that so much. We've decided to do a few lectures, and then I'm sure that Dr. Young has talked to you guys about the project, the group projects that you guys are going to be doing. And we feel that that's a very unique way of bringing the course material into the practice, into the clinical pharmacy practice side. And so that's a new change for this course this year. And I think that's a good change because most of you guys are third years. I think that all of you guys are third years. And this research course comes at a point where you've gone through most of your clinical stuff, and then before you leave, we hit you with a research course in terms of health service outcomes. And for the most part, people are like, okay, well, when am I ever going to use this? Is this on the NAPLEX? When am I ever going to use this topic? And so one of the things that, based on the feedback that we've been getting, we've decided to just kind of change things up a little bit. And so bear with us. This is new for us as well, but I think it's a good, I'm excited in the next couple of weeks to see your projects, to see what kind of research questions and what kind of research you've decided to come up with, and over the next several weeks of the semester. And so, but today I'm just doing an overview of the research process, selected topics, and then ethical considerations. All right, so the research process. What is research? Research is the process of systematically and carefully investigating subjects in order to discover new insights. So as it relates to your project, your community-based or your pharmacy-based assessment, it's a systematic and careful evaluation of the topic that you're interested in. That's essentially what research is about. So research is not something that is haphazard, it's not something that you decide, okay, I'm driving on the highway and then I decide, okay, well, I should just pull over and do research. It's something, there's some systematic process that is involved in terms of the research process. And it typically has 5 steps. Step 1, you identify a study question. So what is the study question? If you're working at a pharmacy and you're interested in opioid stewardship, right? So then the study question would be, what is the most effective way to steward opioids so that employees don't steal the medication? So that might be a research question, that might be a study question that you might be interested in. You want to select a general study approach, design the study, and collect data. So, after you started with the research study question, you identify where you want to do the research. Then you want to design the study and then collect data. You want to analyze the data, and then of course you want to write and share the report. So I've been trained traditionally as a researcher, and for the most part, these 5 components are essentially the 5 components of the research process that I have to adhere to. So for example, if I decide to do a research study and I identify the research question, I decide on the population where I want to investigate, then I design the study and conduct the study, I do the data analysis, and then I stop. Then for me, the research process is not done because the final part of the research process is you disseminating the research findings. And so either you're going to disseminate it at a research medium, you can disseminate it through publication, you can disseminate it through a newsletter. And so for the most part, whenever you do a research study, and so that's where you're disseminating your research finding at a poster presentation at the end of the semester. And so you're walking through the whole 5 steps of the research process. So this is just a figure that essentially breaks down the research process. All right, so the first part is, just like we said in the previous slide, you want to identify the study question that you and your groups specifically would like to work on. Select the study approach. So study approach is usually the methodology, how you want to design the study, how you want to go about collecting the data. You want to design the study and collect data, do the data analysis, and then report the findings. All right. There's two kinds of research study or health research. There is health research that examines biological, socioeconomic, environment, and other factors that contribute to the presence or the absence of a physical, mental, or social health and well-being. So health outcomes research, and this is specifically what I focus in CAP. Say, for example, if I was interested in looking at prostate cancer outcomes in males, and I wanted to look at two treatments. And so from this standpoint, I would be conducting health service outcomes research. If that, and so essentially, I'm looking at whether or not males with prostate cancer receive a certain medication or not over the course of their treatment. And so you have health research, and then population-based research involves human as the unit of analysis. So say, for example, I'm sure that you guys have seen some of these large database analysis or these large population health data, like the CDC. So when the CDC wants to know, there is a population in Washington, parents who have not been vaccinated their children against the measles outbreak, right? That would be an example of a population health research, because what the CDC wants to investigate is they're using human being as a point of analysis, which is children who are individuals unvaccinated against the measles, and then they're looking to see what do they develop full-on measles and what are some of the ramifications for that. All right. So that's the purpose of health research. You typically do a needs assessment, so community health profile. So say, for example, with that measles outbreak, you want to know what's going on and what's the needs of the community. Is it the fact that there's a shortage of vaccine? Is it the fact of people just not vaccinated? So what's the needs of the community? What's the needs? What do you need to do to kind of determine or to get the situation under control? Then, of course, you have risk assessment. So what are the risk factors for the disease? So as it relates to measles, unvaccination, not being vaccinated is a risk factor for the disease. What's the applied practice or clinical effectiveness? So the vaccine, the MMR vaccine is shown to be effective. And so if you essentially give the vaccine, it will essentially work well. And so as it relates to vaccine, some parents don't believe in vaccine and some parents do believe in vaccine. I'm not advocating for either or. I'm not saying that I'm the father of two. I have a 4-year-old daughter and a 2-year-old daughter. I choose the vaccine, but then also the pediatrician that we see, she works with parents who don't choose to vaccinate their children. And so I'm not saying, I'm not gonna stand up here and say, well, the reason why they're getting the measles is on rampage is because parents are not vaccinating their children. It's a choice. And so with all things, the same thing. If I was doing a research study, I would be curious to understand, from a research standpoint, I would do focus groups, and I would essentially want to assess parents who are vaccinated and parents who are not vaccinated, and I would want to know, based on those two groups of individuals, why are you choosing to vaccine and why are you choosing not to vaccinate your children, and then develop a research study based on that. So for me, in terms of a needs assessment, what I would do, I would do focus group to determine the needs of my community. So parents who are choosing to vaccine or vaccinate, there's not a vaccine. Parents who are choosing to vaccinate their children or parents who are choosing not to vaccinate their children, and then I would develop some kind of research methodology to intervene on both ends, right? And then of course the outcomes evaluation. So what's the impact of the intervention? And so say for example, I did this big study where I looked at the measles, and I looked at patients who were children who were vaccinated and children who were not. And then my goal was to increase or to decrease vaccination rate. Essentially what I would do is at the end of my intervention, or at the end of my study, I would do some kind of outcomes evaluation to determine what's been the impact of my intervention. All right. So the best way to learn about health research is to do real research, and so it's a hands-on approach. And that's one of the reasons why we've decided in this course to kind of like give you guys a hands-on experience to, to research. So we've traditionally lectured, and we've decided to kind of to do some kind of group project to give you some kind of hands-on experience. And so that's the best way to learn about health outcomes research or health research in general. All right, and so going back to the steps, which we talked about previously. All right, so we're going to talk about selecting the general topic. Okay, questions are good. So typically when you think about research questions or when you want to do research, questions are usually derived from clinical practice. So what you see in your clinical setting, community observation, so what you see in the community, and personal experience. And so one of the main point of these clinical practice, community observation, and personal experience, it typically points you towards an unmet demand for a needs assessment, program evaluation, and clinical effectiveness study. So essentially, what you're seeing in your community practice, there's usually a gap, and then you go, okay, I'm practicing in rural Georgia, and one of the things that I'm seeing is that patients, as it relates to asthma, their literacy in terms of being able to use their inhaler is very low. So you decide to do a study that looks at asthma inhaler literacy, and so that's an example of a clinical practice-based study. All right, so this next figure 2-1, talks about the different kinds of questions. So you can have value questions. So what are my interests and personal value as it relates to a research topic specifically? What research topics are personally meaningful to you? So these are value kind of, so when you're thinking about research topics and you're brainstorming specific topics, it could be a value-based research topic. You could look at skills, so what knowledge and skills do I already have? You could look at personal growth, what new skills do I want to develop? Look at connections or gaps in the literature. Typically the most common one is gaps in the literature. So typically we often do studies because there's a need, there's some kind of gap in the research literature, and so we want to kind of improve or to fill that gap. All right, so brainstorming and concept mapping. So essentially what brainstorming, I am well aware that you guys are probably familiar with brainstorming. We do it in other settings, but brainstorming as it relates to research or developing a research topic is you create a long list of possible research topics. And so you and your group, you sit down and essentially you're like, okay, what could we study? What are some of the things that we could be our potential group project? And you brainstorm and you come up with a long list. Concept mapping is after you create that big list, then you look at the list and you say, okay, are we interested in adherence? Are we interested in effectiveness? And then from that big long list of brainstorming topics, you develop this concept or this mapping. And so concept mapping is essentially taking that big long list of potential research questions and breaking it down into a few couple of themes that you could investigate further. One of the things that, from an epidemiology standpoint, you usually look at exposure, disease, and population. And so from this basis, a research question would be, or the typical research question from an epi standpoint would be, is the exposure related to the disease outcome in a specific population? And so as we take it back to the measles outbreak, is unvaccinating your child related to them developing measles in the population in Washington or in children in Washington? So that might be, from a pure epi standpoint, that might be how you frame your research question. Okay, so here are a couple types of exposure. So you can look at socioeconomic status. So these are income, wealth, education level, occupation. So these are just like your basic demographics. You can look at health related. So whether tobacco use. So what are some of these health related issues as it relates to disease outcomes, religious practices, use of healthcare services. You can look at health status, so traditional nutritional status, stress, And then also you can look at environmental exposure, so drinking water, population, radiation, noise, that kind of stuff. So these are typical or types of exposure. All right. Then you have type of disease, so infectious. So you have cholera, NCDs, asthma, breast cancer, cataracts, neuropsych disorders, Alzheimer's disease, autism, and then of course you can look at injury. So these are types of disease. And then of course population. A lot of this stuff is once again, it's designed to just give you a basic overview, and a lot of this stuff you're probably familiar or you've seen it before. But when we talk about type of population, it's usually you want to describe the population. So women living in rural Ontario is a type of population that you can work in, as an example. From clinical studies, we typically, when we think about clinical research, we typically look at patient, or the patient/population, intervention, comparison, outcomes, and time frame. And so this is just a type of way of studying clinical research, and so this is essentially the PIPCLAP way of looking at clinical research. All right. So the first part of the presentation was just selecting research, basic overview, very simple stuff. And now we're going to talk about ethical consideration. And so with the ethical consideration part of the lecture, it's just what are some of the ethical underpinning when you do research. And so it's very basic, just giving you just an introduction or to some of the ethical reasons behind why you can't and why you shouldn't do certain things. All right, so the foundation of research ethics, the Nuremberg Code in 1947 mandated voluntary consent for experimental research studies in humans, so it has to be voluntary. You can't decide, okay, I'm going to do a research study and say, you have to do it. It's unethical for me to do a research study to say, okay, all third-year students in the College of Pharmacy has to engage in this research study. You don't have a way to say, no, I don't want to do it. I don't want to sit in, or I don't want to be a part of this research study, so it's unethical for me to mandate that you have to do something. So research study, one of the basis of a research study is that it is voluntary, and participants can say, I don't want to be involved. The Declaration of Helsinki in 1964 was written by the World Medical Association to provide guidelines for physicians conducting clinical research. And then the big one is the Belmont Report in 1979, which was published by the U.S. National Committee for the Protection of Human Subjects of Biomedical and Behavioral Research. And it essentially defines key principles and set the foundation for what we now have in the U.S. as the common rule as it relates to protecting human participants. All right. A lot of these foundations for research ethics came out of research misuse in the past, and so in order to protect participants, and it also protects researchers. So as a researcher, these, especially the Belmont Report, is very important for me because it defines certain things that I can or should not do to my participants, and then it also defines to the participants their common rule, how should they be treated. All right, so from the Belmont Report, which sets the foundation for research ethics, there was a couple of things that was defined, and so respect for person was defined in the Belmont Report, and it's essentially a broad concept that emphasized that research subjects has autonomy and they can choose to volunteer or not. Beneficence means that the study must do some good, so you can't do a research study and at the end it's just, there's no common benefit to society, right? And then distributive justice, it seeks to ensure that the benefits and the burden of the research is equitable. So if we're doing a research study to essentially, if we're doing a research study and we're drawing blood, is there benefit to you drawing blood from an individual? And so the burden of the research study has to be equal to the benefit of the research study, and so that there must be some distributive justice as it relates to the research study. All right. There are 8 ethical consideration in research ethics. So contribution. So what is the purpose of the proposed research? Why is it important? There's compensation. So typically, and these are some of the things that you'll see in, like, say for example, if you're at Athens Regional and you see those advertisement, you see a flyer and it's advertising. We're selecting research participants and we're going to pay them $25 to participate in the research study. And so there's usually some kind of compensation. Consent, how will potential participants be informed about the study? So this is the informed consent process. Confidentiality, you have to be able to protect individuals' privacy. Community, what is research in the selected population? Why is research in the selected population important? And then conflict of interest. Conflict of interest, or the concept of conflict of interest, is, say for example, if I was doing a research study and I was the funder of the research study, and my drug company also own shares in the company that is hosting the research interest, then I would have to disclose that as a conflict of interest, because the outcomes of the research study benefits me, because I own share in the company that is funding the specific research that I'm doing. Collaborators. Are all members of the research team adequately trained to conduct the research, to conduct ethical research? And then committees, which research ethics committee needs to review. So committees, say for example, I recently had submitted an IRB to UGA because I'm interested in doing a study in rural man and urban man in Georgia. And one of the things that I'm interested in doing is looking at genetic literacy as it relates to cancer outcomes. And so Institutional Review Board is an ethical committee for the University of Georgia that will review my protocol and to tell me whether or not there are certain things that I'm doing in my research study that is unethical or is ethical. And so you'll have some committees that will review your research studies. Incentives and coercion. So as it relates to, so I'm going to try to put the next couple of slides within the context of some of the work that I'm doing or some of the work that you might be doing, but I'm going to frame it from the concept of the research that I'm doing. So the IRB that I recently submitted to look at genetic literacy in rural men and in men in the Atlantic area. One of the things that I can't do is the incentives that I'm providing as a gift card can't be something that's going to coerce or going to force men to participate in this research study. So one of the things that the University of Georgia IRB will do is they'll look at the amount of the incentive that you're given. Say, for example, if I'm working in a very low income population and I'm giving somebody $300 to participate in a research study, that is a lot of money to engage in a research study. And so rather than it being something as a compensation or to say thank you for participating in my research study, it acts as something that is kind of like, it coerces these guys to want to participate in a research study. And so there's a delicate balance between the compensation that you're given and not coercing individuals to participate in a research study. Does that make sense? All right. Informed consent is very important. It's not just a piece of paper that I give individuals. Individuals need to be able, or participants need to be aware of the informed consent process and to understand that it's not just a document where you just sign, hey, Dr. Corbin is doing a research study and I want to participate, so I'm just going to sign away my life, or I'm just going to sign on the line. But it's a two-way process between the investigator and the participants, wherein the participant has an opportunity to ask questions and to understand the entire research process. And so it's not just, hey, sign on the dotted line, you can participate in my research study, but it's something that is designed to kind of make sure that both parties are aware of the entire process of the research. So once again, informed consent provides essential information about the research project to potential research participants so that they can make thoughtful decisions about whether to enroll in the study. The statement must be clear, simple language that the reader can understand. typically, these are the components or the contents of the informed consent statement. So the research, it defines the research, what is the purpose of the study, what are we going to do, the purpose, the participants, as in the person that's engaging in the study. We also talk about the procedure. It has to detail exactly what the study is going to be about, benefit, risk, confidentiality, that the patient has to volunteer, contact information, and of course, there's a place for signature. The informed consent process is designed, once again, I talk about this briefly. It's not just a piece of paper, but it's a process where both the investigator and the researchers are both involved in the deliberative process. For most research study, the expectation is that each research subject will sign a printed copy of the informed consent statement. In a limited number of observational studies, the full process of acquiring and documenting informed consent may not be required. So say, for example, if I'm doing an online survey, and I send out an online survey to third-year pharmacy students about their experience in pharmacy school, and then because it's the online survey, there's a button that you'll click that says, do you want to engage in this research study? And you click yes or no. Then there's not a written contract between the investigator and the researcher, or there's not a written paper trail or a written document, but you selected, you essentially decided to be a part of the research process that way. So that's essentially what's talking about there. Privacy and confidentiality. Privacy is the assurance that individuals get to choose what information they reveal about themselves, and then confidentiality is a protection of personal information provided to the researcher. So as a researcher, I have a duty to assure my research participant confidentiality, especially if I'm doing a study where I have individuals disclosing drug use or something like that. It's something that we would have to assure. So sensitive topics like drug use or sexual behavior, researchers asking questions about sensitive topics or sensitive issues must decide ahead of time how to handle disclosures, such as disclosures of participant in illegal activity. So as the research team is coming together, we will decide, okay, how are we going to handle the disclosure of these sensitive issues. Cultural consideration, a research protocol must be appropriate to the culture or cultures of the expected study participants. So if it's just essentially saying that there should be some cultural appropriation for the study that you're doing. So for example, if I'm doing a study, my genetic literacy study that is looking at men in rural Georgia and the same study that is looking at men in the Atlanta area has to be specific to those two populations. I can't assume that the man in rural Georgia has the same cultural as the man in urban Atlanta. So that's basically what that means there. The vulnerable population, children and some adults with cognitive impairment may not be considered competent to make informed decisions. And so typically in this situation, parents or their legal representative will be a part of the informed consent process, but at the same time, those individuals must understand what is taking place, that they're part of, that they're going to engage in some kind of research. And then, of course, the research team typically have to do some kind of ethical training and receive some kind of certification. Here at UGA, we have the Responsible Conduct of Research, or RCR, and it's a program that essentially details, in essence, research misconduct, how to avoid research misconduct, how to engage in the research process, and so how to do informed consent. So it's essentially, in order to engage in research as a researcher here at UGA, I had to sit through, there's this thing called the SIG training. So I had to sit through this module of courses, and they expire every 4 years, or every 3 to 4 years, and you have to renew them every so often. So essentially, it walks you through the Belmont report, it walks you through the foundation of ethical research, and it walks you through the entire process all the way up to how to avoid research misconduct. And so So those are still, and so this is essentially a training certification program in research ethics. That's that's all that I have for you today. So once again, the lecture was designed really to just give you an overview of the research process, selecting research question, ethical training in research. I'm going to be lecturing in this class for the next 3 weeks. This is my first lecture for the semester in terms of your course, but over the next couple of weeks, I'm hoping that the topics will get a lot more engaging. I'll probably do a better job of presenting. And so over the course of the next, I'm probably gonna, with both Satellite and Athens campus, I'm probably gonna try to do things to make it a lot more, I'm probably gonna try to do things to make it a lot more engaging for you so that it's not just, oh, Dr. Kerwin is up here and I'm being bored out of my mind. And so over the course of the next 3 lectures, I try to incorporate a few more things to make it so, because I completely understand. I sometimes when I sit through some of my lecture materials, even for myself, I'm like, okay, it's a drag, and so I can completely understand from your standpoint. I have to give you the content, but I'm trying to wrestle with what's the better way for me, what's the best way for me to give you this research, this content, wherein it's not just okay, he's just talking 45 minutes. And so I'm gonna try to do better in terms of my delivery and in terms of how I approach. Now that I've got through the first lecture, I get a sense of your course, your class here in Athens, and some of the satellite campuses as well. And so next week's lecture, I might show you a video, and then we talk about a few things, or I might walk around and ask questions, or I might buzz the satellite campuses to ask some simple questions. But I hope that over the course of the next 3 lectures that I'm giving, the content is, because I can look at your faces and you're like, oh, like you're sharp already. So I'm hoping that over the course of the next couple of weeks it gets better. All right. Take care, and we made it through the first lecture of my topic. All right. All right. Let's see if I can get around.